I'm sure you've heard an apple a day keeps the doctor away, right? Well, apples aren't so great if you've got SIBO because it ferments fast and it can feed both the good and the bad bacteria. You've heard of probiotics, the good bacteria, but have you heard of SIBO? That stands for small intestinal bacterial overgrowth. We can call it just bad bacteria overgrowth. And the wild part, even healthy foods can make it worse. See, your gut is home to trillions of bacteria. And when the good ones keep the bad ones in check, you've got smooth digestion and even better mood, energy, and immune support. But when the bad ones take over, hello SIBO, suddenly you've got bloating, gas, weight gain, fatigue, skin issues, or constipation, or even loose stool that just won't quit. And that's where the FODMAP diet from the University of Melbourne comes in. It's a 3-phase plan to starve out the bad bacteria, rebuild the good ones, and maintain balance. Step 1 is to cut out the foods that ferment easily, like onions, garlic, wheat, and apples. Step 2, add probiotics and fermented foods to rebuild your gut. And step 3 is keeping that balance steady long term. Since different good or symbiotic bacteria have different effects, like producing serotonin for mood regulation and others for immunity, it's really important to have a good, diverse load of good guys in your gut. Good variety is very important for overall health, and studies show up to 75% improvement in IBS patients using the FODMAP diet. And in my clinic, we had herbs to help knock out the bad bacteria while also starving them out while adhering to that FODMAP diet, which helps reduce symptoms quicker and can help break up stubborn biofilms, which can make people relapse easily. And to stay current, recently there have been studies showing that the Mediterranean diet also helps patients with IBS. They're not sure why, but they attribute it to the high plant fiber and anti-inflammatory omega-3s found in fish. If you think you might have SIBO, talk to your doctor about a breath test. You'll be amazed at how many random symptoms clear up once your digestion's finally back in harmony. You can develop SIBO over time with a poor diet, slow digestion, not enough enzymes or acid, thyroid issues, or quickly after a recent infection or antibiotics. So always try to keep your digestion in optimal shape. I'm Dr. Kyle. Have a good day.